Hi, this is Noelle again with Crosby Chiropractic and Acupuncture Center. I'm actually here with Dr. Crosby. And Dr. Crosby, I want to start by saying, as I've mentioned a couple times now, I came here as a patient myself about 3 years ago. And I had gone to like 4 doctors with my migraines and neck pain. And I finally came to you as a last resort. I wish now I came to you as my first visit to many doctors around. But you were the first doctor out of the other 4 that I went to see who really took the time to ask me questions and find out exactly what was going on, and not just giving me a bunch of medicine and saying, honey, I think this is the best we're going to do for you. You guys not only helped to relieve my headaches after about 2 weeks, you and Dr. Pat especially, but you also gave me so much insight on what I could do outside of the office to help myself. So I want to start by asking, first off, what got you into chiropractic?
Pretty much a life-changing experience like the one you had with us. And obviously you're in healthcare now, and it touched you, it sparked something in you, and the same thing happened with me. I had sciatica, leg pain from the age of 3, and went to a variety of doctors both in England and Canada, and they put me in orthopedic shoes for a while, but then said, we can't find a cause for this leg pain, it's probably a need for attention. So I was a competitive figure skater and gymnast, and routinely my father would rub my leg out at night. It was just excruciatingly painful. And I was living on Tylenol by the time I was 16, 17. At 17, my right leg failed completely. And I went to a new family doctor who sent me to the hospital, actually sent me to an orthopedist who immediately sent me to a hospital in Toronto. And what they found is I have a congenital malformation in my back that does not allow some of the nerve roots to the sciatic nerve to leave my spine well. So the sciatica was real, but by the time it was diagnosed, I had a leg that looked like a polio leg. The muscles had wasted, it was non-weight bearing. And I left the hospital knowing that the surgery, this was in the late 70s, left the hospital knowing that the surgery, they were apprehensive about doing it because it could leave me in a wheelchair, leave me permanently paralyzed. And so I went to my first chiropractor, and he got me functional. I won't say that the pain was gone. But when I went off to college, I re-aggravated my back in a professional dance troupe, and then had to find a new chiropractor who did everything completely differently than my first one. And at that point, I knew that it wasn't the chiropractor who had kept me walking and functional, it was chiropractic. And I switched majors and have never looked back. I felt that if I could help one person the way I'd been helped, then it was all worthwhile.
Well, I think that's wonderful. And here in the office, what would you say are our main specialties? I feel like we have so many, but would you like to target on 1 or 2 specific?
For me, it's the chronic pain patient. It's near and dear to my heart. It's the patient who's been everywhere else, like yourself, who doesn't seem to fit normal treatment parameters, and who needs that extra piece to the puzzle to be figured out so that they can learn to have a better life. Because sometimes it is learning to do things differently as part of your coping strategy that makes or breaks what goes on in here. So we try to, I think, with our chronic pain patients, really educate them, because we may not completely alleviate the pain, but if we can improve quality of life, this is huge. And for someone who knows how effortful it can be to just get up and walk across a room where you have to steel yourself to do it because you just know it's going to hurt. If I can help other people not live like that, then that's my strength. And I use chiropractic and acupuncture both for that purpose.
And I know some people, they're a little hesitant with the acupuncture, but once we give them a session and show them that it doesn't hurt, and you know the wonderful benefits of it, I've seen that many people are willing to give it a try.
Yeah, I think when people see that other patients are getting it, and there's no blood, there's no screaming. In fact, conversations are maintained throughout the whole process.
Exactly.
And they realize, okay, this isn't like having blood drawn or getting a vaccine. This is actually different than that, and that helps them let their guard down. It is truly amazing what you can see happen with a patient when you pull all the pieces of the picture together. And one thing I didn't mention is even nutritionally. Sometimes there are nutritional roadblocks. Maybe they're not getting a nutrient they need or enough of a nutrient they need, and sometimes all we have to do is tweak that a little bit, and then the push towards the self-healing just happens. Usually we get an injury, we assume we're going to get well. Our body has a wonderful way of pulling itself together and doing just that. It's identifying those roadblocks and figuring those roadblocks out that make all the difference.
And I was impressed also, not only did you send me off for an MRI when I was so nervous about my headaches, but you also allowed me to go and get blood work done so we could look and make sure that I wasn't deficient in anything. So you guys go over and beyond, in my opinion, what I ever thought a chiropractor could do, because I was just unaware of that. So I was so impressed with all the aspects that you're able to take care of. So
we are physicians.
Yes, exactly.
Chiropractors are physicians, and consequently we can do all of that. Now there are some who choose not to, but for me I think it's critically important, especially if I'm looking at patients with goofy neurologic symptoms that are unexplained by any traditional tests like CT or MRI or other imaging. It's amazing how often we find B vitamin levels are off. And as soon as we fix those, whether they're over or under, as soon as we fix those, these neurologic symptoms seem to go away. And it's really terrific to see that happen in patients who have literally bounced from medical doctors to neurologists through every test under the sun. And they're being told, we don't know what's causing it. Maybe you're pre-MS and we're just not seeing the lesions yet. Or maybe you're maybe you just need to be on an antidepressant or an anti-anxiety medication, and yet you take care of the B vitamin levels and it goes away.
That's amazing. Well, I'll just finish with my last question today. When you wake up in the morning, you drive here, what do you find that you look forward to the most during your day?
Always the good stories. Always the patients who say, I haven't felt this good in years. I didn't know I could feel this good. I thought it was age related. I thought I'd be living with this for the rest of my life. Those are the things that I'm here for, and those are the things that make my day. No matter what else is going on, generally you hear one story like that every day, and that makes your day.
Well, Dr. Crosby, I'll never forget the moment that you got to come to me and tell me, honey, you're not going to die, you don't have a disease, you don't have a stroke, you simply have a really bad neck. And we're going to help you with that. I'll never forget, you put your hands on my face and you let me cry, and it was a beautiful moment. So I'm so glad I got to share that moment with you, and I'm so honored to be able to be here and represent all of our doctors here. So thank you for taking a moment to let the viewers get to know you better.
Oh, you're welcome.
Thanks.